Hello, everybody. Hello. Oh my gosh. So I feel like it's been forever since I've seen all of you. So happy Wednesday. And we are going to chat about a whole bunch of COVID news. And I've got a ton of information to share with you. And our core topic today that we are going to talk about is a particular nutrient supplement that has a really powerful resources for all of you and your bodies. Particularly, it helps with individuals who have autoimmunity, who really want some neuroprotective power and impact, as well as individuals who might be dealing with a little depression, anxiety, ADHD, even OCD. It's very potent. So I like this in combination with one of my stress support supplements. And so I actually have it here, and we'll talk a little bit more about stress factors, but particularly this one compound is quite amazing. So welcome all of you. I hope all of you had a wonderful Labor Day. Good morning, Pat and Ron. And we've got Instagram and YouTube on live. If you are catching this and it is not live, there will be details in the description box below where you can just fast forward to the topic at hand if you don't want to learn about COVID news. But it's been since Friday, since my last live, and a lot has happened. So let's just jump right on in. And as I'm detailing the news, I'd love to know where you all are tuning in from. And if you all had a wonderful Labor Day holiday, hopefully everybody was safe and taking all of the right measures to social distance. So let's talk about the world. Right now, we have 27.6 million COVID cases across the US. The big news over the weekend or Sunday and Monday, India moved into the second spot. They surpassed Brazil in the quantity of cases. I think Sunday they posted the largest day ever to date, 90,000 total cases. They tested 1 million Indians on Sunday and 90,000 cases came back positive. Brazil is trailing them at 4.1 million and Russia is at 1 million. The US is at 6.4 million. And before we dig into domestic news, I do want to highlight a few national bits. We are seeing the UK is concerned about a second wave, and they have implemented a now new rule that they will be limiting gatherings of 6 or more collectively. This excludes weddings, office work, and sports, but any gathering, bars, events, that's now postponed indefinitely. England and Wales have seen increases. They've had over 3,000 plus new cases on a daily basis, and it keeps growing over the last 4 days. So they are immediately taking note of canceling events. They are also fining individuals if they break up a party or group of people, 6 or more, or 7 or more. They will be fining them £100, which works out to be $130 US, and it will go up to I think $3,600 if you are a repeated offender of this rule. The other thing that I do want to note, USAID, we had a Corona task force, our COVID task force, that is effectively being shut down this week. I actually have a friend of mine that I traveled with in India, and then she ended up going to undergrad at she did her graduate programs at my undergrad school, Florida State. She works with USAID and had been in Madagascar. So I follow very closely about USAID. They are shutting that down. And that was a really big element in terms of helping a lot of the countries get and secure ventilators and other PPE and equipment. But something globally that we need to note, there's more information about food shortages. But particularly food, the price and cost of food has gone up incrementally. So June, July, and August, it's gone up each month consecutively. And food prices are up 11.2%. The highest price point, pork has gone up in some areas of the world by 52.6%. And there's a lot of concerns about food shortages with COVID and accessibility. So that's very interesting. I do want to make a note here in the US. Let's dig into some domestic news. We've got 6.4 million cases. Yesterday, we had 23,000 new, almost 23,500 new positive cases. It's down partially because we also still have a testing shortage, limited testing supplies, but deaths, our fatality rate is now 192,538. We are quickly approaching 200,000 fatalities total. Some things to note, Labor Day weekend was this weekend. Lots of concern about Labor Day as a super spreader. Some things that are not boding well for Labor Day weekend. TSA reported they had the highest quantity of travelers since March during the Labor Day weekend. So airline travel's up. Also, we have seen the summertime. So from Memorial to Labor Day, the US had quadrupled the amount of cases that they had before Memorial Day. So we quadrupled our cases in the summer. Part of that they list and link to the beginnings of some of these super spreading events during Memorial Day holiday. We also have some information that the average cost of a COVID case, a non-fatal, so meaning not as severe as going in and being on a ventilator, but the average cost for an individual to have a diagnosis of COVID is $46,000, and that's a non-fatal case, which is pretty substantial, that cost, all the different resources and medications and just therapeutic care. What we don't talk about are breathing treatments and things like that, oxygen, sometimes home care is ordered, multiple visits, multiple check-ins, 1 or 2 stays in a hospital bed. That quickly adds up. The other thing that just came out, and I've got this here, is the Children and COVID report from the American Association of Pediatrics. And, this is, again, data that is collected from 49 states. It also includes New York City, DC, Puerto Rico, and Guam. And 8 of the states provide distribution of testing, like the distribution of age, or age distribution. So, the breakdown of ages. And then 23 states provide the distribution by age of hospitalizations, and 42 states provide the age distribution in fatalities. And the areas that are really, really hardest hit, or you kind of see the states. It's kind of weird. They put these little boxes, but basically this is the US and the states are the boxes. But Florida's been hardest hit in the 0 to 14 category, as has Utah. So younger children have been hospitalized with COVID, and also have been diagnosed with it. So, that is a little bit of a challenge depending on the age group. But again, we're really limited with some of the reporting metrics, but it doesn't change the amount of cases. And what we are now at 500,000 kids diagnosed with COVID. And this is through September 3rd. So last Thursday. In the period of August 20th through September 3rd, that's when a lot of schools started to return. And again, 19 and under is what is the age group that gets categorized in this. So there are some college kids that get categorized in this report. It is interesting to note that we've had an increase of cases just those 2 weeks by 16%. And there was, I think, a 23 or 24% increase from the previous 2 weeks. So we've seen just August a major growth in terms of the cases of kids. But the state that's hardest hit, so this is a cumulative number, the number one state for children with cases is California. Next up's Florida, Tennessee, Illinois, Arizona, and Georgia. So we're in Georgia. We're 1, 2, 3, 4, 5, 6. We're sixth largest cases of kids. It's one of the reasons why we are doing distance learning and virtual learning upstairs right now. As of the 3rd of November, children represent 9.8% of all available cases, and 32 states report that 10% or more of their cases were children. And New Jersey and New York City report that only 3.5% or less of their cases were children in orientation. Cumulatively, so when we look at the kind of per capita quantity of cases, the greatest per capita, it's Tennessee, South Carolina, Arizona, Missouri, and Louisiana. Those are higher in terms of the overall rates of children. So the average is this little line here, it's 680 cases per 100,000 children. But Tennessee, South Carolina are more than double that, which is very concerning. So those are states that obviously would be per capita be considered staying at home, distance learning, virtual learning when possible. And then this is some information that kind of details the cumulative, the growth in terms of cases. Florida, particularly Georgia, South Carolina, Tennessee, North Carolina, Louisiana, Arizona, California, Illinois, Ohio, Virginia, they had the highest amount of caseload in that 2-week period of time. The percent increases, Montana, North Dakota, South Dakota, Missouri, Kentucky, and Indiana had the greatest increase in cases. So that's interesting. There's a whole lot more. I will make sure I provide links down below, but for all of you concerned, there's a lot of data there. Now let's talk about the big news that's come out. You guys know I said I'd be staying on top of this, and there have been some major clinical data and researchers on this. Okay, I've read a lot of this. This is the Sturgis report. And so this comes out of, San Diego State University. It's their Center for Health Economics and Policy Studies. And it's a working paper that digs into the contagion externality of a super spreading event. So basically, in layman's terms, the extent that this super spreading event, the Sturgis, spread out and was contagious across the nation. That is the breakdown of what that means. They look at the rally, the Sturgis rally, and COVID-19, and this is the gist of what they've come out with. They have articulated, and we're talking like these aren't numbers that are made up. This is epidemiological data. There were a total of 460,000 participants at the Sturgis rally. They use smartphone data and a whole bunch of other data to extrapolate the quantity of participants. And they talk a little bit also about the potential spread that occurred. And I do want to make a note, since this has been released, that we do have a death. We have one fatality thus far from a Sturgis-oriented COVID case. So I don't have the details if they attended it, they live in Sturgis, or but we do know that that is linked when contact tracing to a participant who got COVID at Sturgis. So let's talk a little bit about the percentages. They have extrapolated that in August alone, we had 1.4 million new COVID cases here in the US in August alone. What they've identified is that through contact tracing and all the data we know in terms of the quantity of cases to date, that 19% of all US cases came from Sturgis, contact through Sturgis, spread from that event. Right now it maintains, or will be, and might maintain being the largest super spreading event to date. They extrapolate that 19% is 260,000 new virus cases came from Sturgis alone. Now, the South Dakota Health Department's a little up in arms about this, obviously. I will say that in South Dakota alone, they have 124 cases linked to Sturgis. But that doesn't include, and what this report does is it looks at the cases in Minnesota and Wisconsin. And I had posted to you guys, I think a week or a week and a half ago, that we had at least 8 to 12 states that had links back to Sturgis. Well, now we are seeing that spread. And that's what they've identified. Even further than that, we can go back and look at the links. Now, what's crazy is the challenge here is that we can't have all the contact tracing of those 460,000 participants, but from the cases, we're starting to get a better data. I will say, and I want to show you this, what they do. They actually put together, let me see, I didn't mark it. Hold on one second. It is an empirical approach. So literally, this is their scientific equation that they plug and play all this detail, and that is how they get the quantity of cases linked to this. So, and this is over 56 days, I think is what's listed on that. So Sturgis itself had COVID in that community. There are also people who had COVID who gathered. So it might have just happened a month ago, but we look at there are folks who are contagious before then, and then the converging on Sturgis, now they have the growth. So those individuals who were sick and went and might not have known it, they're asymptomatic or pre-symptomatic, that is also linked up in this data. But I will say what they've extrapolated the cost to our healthcare system is $12.2 billion, which is pretty darn crazy. That you'll probably hear a lot about. Again, could very well stand to be one of the world's largest super spreader events to date. I think we're also going to see probably super spreading events as I'm watching these rallies getting together where people are not social distancing, not wearing masks, and in tight enclosed spaces. So one happened in DC recently, and we're seeing North Carolina recently. I think we're going to see Wisconsin's next, or Michigan. So those are things that Sturgis, I hope we learn some things about. Last week alone, 26 states had increases in COVID cases. The major states, 15 states, are in that kind of warning phase: California, Florida, Texas, Illinois, and Georgia; South Carolina, North Carolina, Virginia, and Tennessee; Alabama, Ohio, North Dakota, and South Dakota are in that category, as well as Missouri and Oklahoma. Now, let's talk about the universities. We got a lot of news about universities. So there is an outbreak in New Hampshire linked to a frat house. They had 100 people at this frat house partying, and right now there are 11 cases in the community linked to the frat house party. Right now we have just nationally, we have 1,500 colleges and universities in the nation. Right now, 750 of those institutions comprise a total of 26,000, a minimum of 26,000 or more cases to date. And right now, there's a little bit of some discrepancies in terms of what do colleges do? Do you lock down your dorms? Do you lock down the apartment complexes that might be on campus? Do you send students home? And one of the big things that's being highlighted by epidemiologists is to not send them home. So if they've got a potential risk of spread, the worst thing to do is to pluck them off of campus and send them back to their communities. That might be across states. They might have to get on a plane to fly back home. You know, if you're a Californian and you're up in Boston, which I met a lot of friends from that area, you can't just drive across the state. And even if you do, you're going to be potentially spreading COVID if you've had exposure. So there are colleges that are sending kids home, and they are saying that could very well ignite a new resurgence. So you've got Sturgis in its own category, and then you also have the college, university campuses trying to figure out what to do. So I'll tell you, to date, we've got James Madison University in Virginia. They have sent kids home. Cal State in Chico has closed and have sent kids home. University of Indiana in Bloomington, they've closed 40 Greek houses. So that's a lot of kids. Like, where do they go? And most of the time when you are on campus or off campus, you already have your rent and contractual stuff. So the big question is, what are they going to do? Where do those kids go? And how do you minimize that spread? And then we also have reports that some schools are pivoting where they're not sending kids home and they're not closing campus, the frat houses and things like that, but they are locking down in terms of there's no more in-person learning. And we're seeing San Diego State, they have gone to remote learning. We also seen University of Alabama, which, by the way, they're in the number one. So they like to be, I'm so anti-Alabama. They like to be, number one in football, but they're also number one in COVID cases. And that is not the thing to be happy about. And so they're trying to pivot with virtual learning for a period of time. But this is most notable. University of Pennsylvania, a football player who went back to California, went back to his home, he has died of COVID, and his exposure was on campus. So that's where we're at in the world of universities, and it's pretty crazy. And we're just going to see greater spread. Now let's talk about the vaccines. I'm so bummed. I was really looking at that Oxford study and the AstraZeneca trial. They have suspended their trial. One participant has become ill, and they don't know why. And so that's going to be the big thing they want to discover. But with the vaccines, they get exposed, and it's possible that he had a reaction to that. We're not sure if it's the protein spike itself that caused the upper respiratory inflammation, but there's the side effect that's been noted with this. And I say I'm bummed because I thought that it looked so promising in terms of the data that not only was it creating antibodies, but it had the connection to create these T cells, the memory T cells, and that yielded additional power and potency with this vaccine. But when we're talking about the vaccine debate, and the vaccine, it's a war in terms of, who's going to have the number one vaccine. UK, England, Wales, Scotland, they had an agreement with AstraZeneca that if that was successful and it proved to be fruitful and passed all of the different elements it needed to pass to be a successful vaccine that's safe and had efficacy, that country would be in line, and they had already put in a quantity million doses of orders. And so now are they back to square one? So there's a lot to be discovered by that. But I just want to remind folks that, this whole speed of vaccine, the acceleration is not, there's a lot at play. And, it looked really promising. And, here we have one case. And that's where a lot of the concerns are with like that Russian trial. Or, it's not it's a trial, and it's being purchased and distributed in multiple countries now. And we still don't know how effective and how safe it is. They only had 76 people be a part of it. So the idea of us having a vaccine by October, by November, by December is really not necessarily a very realistic expectation. So, what everybody's saying is that we're probably going to be looking at the first half of 2021 of having these still, get to market. If you are curious and you want to learn more, there's a lot of details in a new free docuseries. I've got that linked in the description box below for you guys on YouTube, which, by the way, if you're loving this content update, give me a thumbs up. I appreciate that. Hit that share button. If you are new, I hope you subscribe. But, the vaccines are these, the speed of them is very concerning for a lot of us health professionals. So that's one of my latest updates there. I also have some updates. We've got some new data about food workers, our frontline workers in the fields picking strawberries and flowers and all sorts of edibles that we are eating and consuming here in the U.S. We have 57,000 food workers, and these are folks in poultry plants, meatpacking plants, all over. 6,700 of them have tested positive for COVID, and they're very much a vulnerable frontline force. And so there's some data out there, and many are undocumented. Many don't have access to healthcare. So that is something that I wanted to highlight news. The other news that I wanted to highlight is with this virus, we now have what we say it's 1,000 lineages. These are kind of strain types of this virus. And we can kind of link to a multitude of different types of stronger lineages. And there's some overlapping sources of origin. So like the first lineage and the viral sequences, they came from China, and global exports including Asia, Japan, South Korea, Australia, the US, and Europe. The second lineage is a viral sequence that came from the Italian outbreak. There's a third that came from the new European, or as a new European lineage. A fourth represents sequences from the UK, Iceland, and Turkey. And then the fifth represents sequences from the Netherlands, Turkey, Saudi Arabia, Egypt, Finland, and England. The sixth represents a sequence in the Netherlands. And then the seventh represents sequences from Turkey, Saudi Arabia, Egypt, Finland, and England. And why they know that, there's actually a Nigerian scientists actually identified in their country alone these 7 lineages within their cases. And what they talk about, the importance of tracking the lineages, is that they can be used and be very helpful in determining how it spreads, the virus spreads through the communities or populations, and that if there is a new strain, scientists would have important info to contain it. So we're getting a little bit more detailed into the viral sequencing and the kind of DNA, the makeup of the virus, to be able to identify its source. Primarily, this is for contact tracing purposes. And they also talk about in Africa why this is important. There might be a new strain that pops up or a new lineage in Africa. And so the Nigerian scientists have at least identified 7 beyond that, and that there might be another one that pops up specific to the African continent. So that's a lot of our news today. There's just so much information. I wanted to kind of share the biggest elements of that I thought were relevant and important. I will end this, the news part of this, 2 things. The latest projection from the University of Washington, their Institutes of Metrics and Evaluations, they project that we will have 400,000 deaths from COVID by the end of the year. And they've been pretty much on point with their projections, which is very scary. And I'll remind you, we're closely approaching 200,000 fatalities to date. And then also, this is, we are in a really special season with kids, and, we have Halloween, school starts, Halloween kicks off, then we go into the holiday Christmas season. And already we're seeing our neighbors talking about, what are we going to do with Halloween? And, they're like, we're still having Halloween. Well, LA has banned Halloween. They've already put it down that the Halloween, any festivities, festivals, it's all locked down, not happening this year. And that is just devastating just to think about it. I mean, I understand we have to be safe, but these are these little happy things that, especially when you have a little like I do, who already has got his Halloween costume, he's got it figured out. He wants me to order it. And we have a birthday in 2 weeks, trying to figure out how do we make this happen and still have normalcy is going to be challenging. So now let me make a note of our time here. Let's see, it's 28. All right, so I always try and make a note of when we start our show, the second part. So the second part of our show, I want to highlight a particular nutrient that I've come across. It's in supplementation that I recommend, but I've been digging further into it to kind of identify and understand just how powerful and impactful it can be. And I think it's something for us to consider and definitely take a look at in the event that you may have one or more of these typical symptoms or conditions, especially with COVID. The lockdown, the changes, the stress that's put on a lot of us, especially us parents or caregivers to, elders or other family members. We're juggling a lot. And with that comes neurological imbalances, neuroendocrine imbalances, lots of stress, anxiety, depression, all of these things occur. And then we have the kickoff of some immune impairments. And this one particular nutrient that is often it's considered or categorized in the form that it comes in as a dietary supplement. In different forms, it's actually in pharmaceutical medication, but this is not at that power. It's not at that grade. It's very minor. And to be honest with you, the risk of any type of toxicity is minimal. So I want to highlight something called lithium orotate. And most of the time, like, oh, lithium's really bad. Wait a second, it's in batteries. How can that be beneficial? But lithium orotate is in a particular, it's a particular form. And, one of the things with compounds, especially if you remember chemistry, the very end, like orotate, sulfate, all of the different endings are, the suffixes tell you a little bit more about its chemical composition. So, and that's where this category would be often in a supplement. So this happens to be in a capsule that I use and recommend frequently that helps to address stress and the side effects that occurs with stress. So let's talk a little bit about some of the elements or conditions that it can address, and then I'll kind of break down how it can be potent. So lithium orotate will often be found, it's generally not going to be something you would buy alone or on its own, but it would be found in a synergistic type of supplement. So for instance, the stress factors that I use, as you see, it's in a capsule. So it's also in a really small amount, like 5 milligrams, nothing crazy, but it gets encapsulated in along with B6, L-theanine, hops, passion flower, and inositol GABA 5-HTP. So I love this stuff. I've got this link down below. But on its own, the lithium orotate can be and has been linked to being a neuroprotective or having neuroprotective properties, meaning it helps protect your brain from oxidative stress, from chemical stressors, and can protect the brain from disease and degeneration. So I talked a little bit about that Alzheimer's DOCUSERIES, which, by the way, I've got that link down below. It's pretty spectacular. It really is very impactful for supporting and protecting the brain from disease, Parkinson's, MS. It breaks through the blood-brain barrier, which is really potent. Not all supplementation or compounds have the capacity to break through and to affect the brain. This one does. And especially when we're looking at neuro-COVID, this might be a very helpful substance as well. And again, I have to make my disclaimer. My lawyer has advised me I've got to recommend or let you know there's no cure for COVID. And I appreciate all of you are like, there are cures. Well, I can't make that. I can't say that. So legally, I can't say that. I would get kicked off YouTube. I can't do that. So professionally, there is no cure for COVID. We know that there are trials of therapeutics, pharmaceutical therapeutics. As a naturopath, I always recommend eating well and eating clean and trying to support and balance your body. But again, no claims here on the COVID side. So with that being said, it is neuroprotective. And I do think it could very well be helpful for some of the symptoms that people experience, but also it's a mood stabilizer. We do see that some antidepressants actually have the lithium, a totally different chemical composition, different lithium. But again, lithium's, the origins, it's all the same. It's just what version. The pharmaceutical version of lithium tends to be an antidepressant and can actually lift people's moods. Well, the lithium orotate in its dietary supplemental form, its safe form, can do the same. So that's very potent. And as it's a mood stabilizer, it can help with folks that have really extremes, the bipolar elements, folks that have, these are elements that fall into the spectrum, the autism spectrum, ADD, ADHD, OCD, those are the kind of very beginnings. And those folks don't get diagnosed with autism, just to be clear, but it's in the spectrum of brain dysfunction. And one of the things that is nutrient dense or can help support the nutrients needed to balance the brain and some of these imbalances is this lithium orotate. So folks that have also, compulsive behaviors, maybe addictive behaviors, and this qualifies not just alcohol, but food, shopping, People can be addicted to sex. They can be addicted to opioids. Whatever the addiction is, there's that underlying chemical imbalance. Lithium orotate is very beneficial for that. So is often used for folks in a therapeutic setting. I will say, having come from the Florida community, in particular being in the Tampa Bay area, the coastline, there are a lot of natural drug treatment centers. And when I say drug treatment centers, like folks who had alcoholism, opioids, pain meds, and I would see very frequently, a 75-year-old grandmother that was addicted to opioids because she had dental surgery. And the dentist would not just prescribe one, an opioid, totally not necessary, but they would prescribe more than the needed days. They'd give her, 30-day supply and she'd get hooked. So lithium orotate can be helpful in that category. The other thing that it can do, and this is really exciting, is the ability for your bone to regenerate. So it can help calcium and articulation of calcium, whereas you see calcium in your veins and vascular channel, we see the capacity for it to help support our bone health. So osteopenia, osteoporosis, those candidates can be very helpful with the lithium orotate. The other thing that I really love as far as immune functionality is it helps boost the mitochondria function. The mitochondria is the heart of your cell. Another very similar kind of category, digestive supplement or over-the-counter dietary supplement is CoQ10. CoQ10 is an energizer to the mitochondria, and it invigorates our cells. Well, lithium orotate has a similar effect. But most importantly, it increases your immune function by supporting the mitochondria. And some of that immune function is actually increasing your white blood cell counts. So many of my my patients that have autoimmune disorders and dysfunctions, they are very much supportive or need support with their white blood cell counts. They will have low counts, or they'll have some imbalance where the body just is not immune functional. This provides the immune modulation, the immune regulation, which is wonderful. And I really love that. So what it does is it actually stimulates white blood cell production. Now, also, this falls into the category of a cancer patient, or also individuals, not necessarily with cancer, but they get prescribed. I just think about my lupus patients, that many of them have low white blood cell counts. They get prescribed oral chemotherapy medications to try and combat the flare that they're experiencing. And it is something that is very, very beneficial to their overall immune function. And what's exciting is it comes in this awesome product that is pro-supportive of stress. So when we break down, we're all dealing with an exorbitant amount of stress. I think we're 6 months in, we've all kind of gotten used to this. The reality is that we shouldn't be used to it. This is not normal. But that's human life. Like, you just kind of adapt. So we've adapted, but in that, our stress response mechanism doesn't always adapt. And so we have to really take care to manage and mitigate the stress impact. And some of the side effects of stress are these conditions. We see a reduction in brain function, the focus and the balance of the neuroendocrine system. We see changes in our mood. We see people who are having more experiences of depression and anxiety than ever before. This is really critical that we really address balancing that. And I think there's a lot of benefit here also on the immune side. I see Colleen Moore. She has a criticism here. She says, good info, but I thought I would hear more optimism regarding the amazing ability of the human immune system to heal itself from a channel focused on natural approaches. Well, Colleen, you're probably new and watching, so welcome. I would recommend you watch a multitude of my videos. I now have over 700 videos, and I am focused on natural approaches. But here's the thing, your immune system just doesn't automatically turn on and woo, it's balanced. You actually have to make improvements in your health. And sometimes it is not just diet and herbal support and other therapeutics like Reiki and acupuncture and reflexology and breathing, like yoga and Kundalini, you actually need to support the nutrient density and the certain compounds needed to build that up. So I'm not quite sure where you're going with that, but I would encourage you to watch my content because I think you would be happy. I can't make everybody happy with my channel. And a lot of times the content that I specifically talk about for the day might turn people off or have you think that my channel is, deviating a certain way. But again, there's over 700 videos here and there's a lot of content on different topics. So I've done now, I think we are at just under 200 shows here live with this particular content where I report COVID news and then specific ways to support your body. Within that, I've talked about heart health. I've talked about blood clots. I've talked about platelets. I've talked about food. I've talked about stress. I've talked about a lot. So definitely please check out my library before you start making assumptions about my content and my motives. Okay, so let's see. I see some comments. Ahmet, thank you so much for a sweet comment. Get Up and Glow Rena says this is so sad. Yeah, absolutely. And let's see. Any other questions? Okay, I see a lot of folks on Instagram. Okay. So, what I would recommend for folks that are feeling a little angsty, a little depressed, a little down, and, my big concern as we start, and we're starting to feel it here. The mornings are cooler. Like this morning, I thought, oh, it's got to be like 5 something. And sure enough, we were closer to our alarm. The days are getting shorter, so it's not as lighter. It's not getting as lighter, or it's not getting light in the morning as it was earlier. It's getting dark, it's staying darker longer. And so things are changing. We're in that seasonal change. And with the seasonal change, for many of you who live above the Mason-Dixon line here in the US and in other parts of the world, we do notice changes, the seasonality changes. It impacts the way our body manages our environment. And so it's very possible that this year we will see a coupling or the exacerbation of the seasonal affective disorder. And I have experienced that when I moved from Florida to Boston. Holy cow, it was very challenging. And I'm hoping to put together some edited content about the seasonal affective disorder. But specifically, I really do feel like this lithium orotate in this stress factors. I mean, I love this. I take it at night because it has the hops, the L-theanine, passion flower, GABA, 5-HTP. If you want to sleep well, this is another one that's helpful. I pair that up with my REM sleep and boom, it is great. So I wanted to highlight that for all of you. And let's see, Christine, with healthier living, my immune system is so much better than it used to be, and Doc M helps with that. Thanks. Lots of helpful content. This is not a commercial. Thanks, Stacy. Let's see. We've got Ahmet making sweet comments over there. But so this, I wanted to highlight. The other thing I just want to highlight, if you guys are curious about the DocuSeries, they're totally free. They're amazing. I've got them linked down below. The vaccines revealed, they bring in scientists, they bring in researchers, they bring in folks to give you everything. And it's not one-sided. One of the things that is great about this crew is it's not going to be as kind of controversial as some of the things that have come out on YouTube before. So I think you'll like that. The other thing is that the Alzheimer's DocuSeries, that's kicked off. Please do check that out. That's going to be amazing as well. And I'll put out, I've got some emails I've got to get out this week. And the other thing too is I've got new blog content, blog materials on my website. So do check out my website. That's linked down below, but you can just go to naturalhealthresources.com. I'm trying to get out a blog a day. And then next week, I'm hoping to start seeing new patients. So cross my fingers, we get it all worked out, and I can post that detail to you on Friday. And Friday will be our live show. And then we'll see, we'll go back to Monday, Wednesday, and Friday. I was grateful for all of you who voted you wanted a day off. It was great. And so Trisha says, good morning, I love your videos. If you have stage 2 chronic kidney disease, would Inflame X affect your kidney? I don't believe so, but that would be one thing I would talk with your nephrologist. and see sometimes with folks who have chronic and stage 2, you might be taking some medications, you might be on dialysis too. And sometimes they do highlight herbs to stay away from. I just don't know everybody's situation. So you have to really ask and communicate with your care providers who are caring for that specific category of health concern. Tracy, if I'm not actively taking care of my immune system, I believe I'd be in a wheelchair. Yes, absolutely. So I really encourage all of you to be in the driver's seat, literally, of your healthcare. You can't rely on a doctor to be the end-all be-all to help you figure out what to do. And the honest reality is that many MDs, all they do is just write scripts, and that is a legalized form of distribution. Do they necessarily always get down to the root cause of your imbalance? Are they trained that way? Not particularly. That's where a lot of osteopaths and a lot of naturopaths like myself and other individuals who learn more about how to address the underlying elements within your body. And the reality is that our body is symbiotic. When you have one imbalance, it creates and affects other systems and creates its, these other imbalances. It's a ripple effect. And the body, it has to balance that. So it's we're always constantly trying to achieve balance. Do we stay in that state? Yes, you can, but you've got to do everything to keep that. It's like, that one little pendulum game where you've got all those little balls and you pull one back and it just goes back and forth. Well, you want to get it where it's stabilized. But, COVID and the situation we all find ourselves in all different ways, you might be frontline worker going out, you're nervous, you've got a lot of concern about your own health. You have family members at home who are, healthy. You might have very similar kind of effect. Like here, I'm not working in my practice and my career's been impacted, in a great way, but we're all dealing with this. And many are dealing with financial challenges and frustrations. And there's just so many different things to compound. And each of those elements pulls those pieces, those balls back, and you're always trying to stabilize. And so that is one thing. We also need to understand the seasonality. We all have seasonal impacts. And so sometimes it might be seasonal allergies. Maybe you have a greater impact on your body with the spring allergies. Maybe it's in the fall, or the changes in the way you're not exercising outside like you did when it's colder out. You don't feel like doing that. So we just have to make adjustments. And the thing is just to know that you have the greatest control, but you are living in your body. Nobody else is. And you just have to stay on it and know you deserve wellness and you deserve to feel your most optimized self. And, do you always have to outlay a ton of money for supplements and things like that? Not always. I mean, I get a lot of folks saying, well, you recommend stuff all the time. And, it's not for everybody to take, but it might benefit people. Like Ephesoy is great for hot flashes, but not everybody has hot flashes. And so, you shouldn't take that if you don't have that. But, I do think that a lot of us have had life experiences that creates imbalance. And the degree to the imbalance really depends on how long it's going to take for you to create that equilibrium and to manage it. And, the more management, the more scrutiny you have in terms of your health, the greater control you're going to have. And I love that Tracy, is actively engaging on supporting her immune system and is noticing the impact of her own efforts. Angela says, I get sad, but I'm hopeful that I'll be okay this year since optimizing vitamin D. Yeah, vitamin D is key. 5-HTP, vitamin D were big. So this is our show. Please give me a thumbs up if you enjoyed this. I will add a whole bunch of links later this afternoon. I've got to get into my homeschool. Gabriel's assistant at school. This week is definitely way more academic. So he needs all sorts of stuff and management. So, but soon we will have a 5-year-old on the 21st. Our little man turns 5. It's very exciting. I'm stumped at how we can celebrate his birthday virtually. And so I am going to be hitting Pinterest and looking at some of the parent boards to see what we can do. That's exciting. So Anyway, thanks everybody for tuning in. I missed all of you. I feel like my mornings were missing a huge piece of my daily lives, and you guys are so impactful on our lives, and it's just so great to see all of you. So I appreciate each and every one of you who tunes in, takes time to be a part of our community, and encourage you to like this video, comment on it when it's all wrapped. That totally helps me in the YouTube algorithm. And I will also be posting some information about things on the YouTube community tab. So look out for that. And Kathy said, what was that you said for hot flashes? EFFISOY, EFFISOY, SOY. Let me write it. And actually, I have a blog article, Kathy. So if you go to my website, naturalhealthresources.com, go to the blog. I can't remember if it's the third one down, but I talk about the hot flashes and EFFISOY, and I break down all the details. So do check that out, and you'll get all the ways to grab that. But yes, thumbs up. Thanks, everybody. Have a great day. I will see you on Friday for a live Q&A. Bye, everybody. See you later. Thanks, Pat and Ron.